Have you ever had to work with decision makers who don't understand the issues they're making decisions about? Have you ever had to have a discussion with someone who speaks your same language but doesn't speak the same language? How do you get people with a different frame of reference to understand your perspective? Virginia, like most states, receives funds from the federal government to create a state rural health plan. This is a strategic plan intended to improve the healthcare infrastructure in rural parts of the nation. It has to be revised every 3 to 5 years. In 2012, Virginia's was due to be revised. An event was held to bring all the stakeholders together to share concerns, brainstorm solutions, and choose priorities for the way forward. 130 people attended the event, many of them employees of the Virginia Department of Health who had never traveled outside the Virginia capital for anything more than a weekend vacation or to participate in a mission project. Practical experience of living, working, and providing healthcare in rural Virginia was not required. But because the federal funds for developing the plan are funneled through the Department of Health, they get the final say on the content of the plan. It was therefore essential to get them to listen to ideas from rural stakeholders with open minds, to question stereotypes and correct preconceived assumptions. But how do you accomplish that step within the framework of a day-and-a-half event and still have time to discuss the plan itself? You might be a rural if. Stealing shamelessly from Jeff Foxworthy's "You Might Be a Redneck If" comedy sketch, we invited rural stakeholders to submit their "You Might Be Rural If" statements in advance of the event. We made requests through electronic newsletters, our Facebook page, and personal connections. Those wishing to contribute emailed their responses to the event coordinator, and they were sorted and compiled. Some were funny, some were factual, some had more than one meaning depending on the perspective of the person reading them, and some were even offensive. Of those submitted, we culled through and sorted and selected 178 that we felt best represented the realities of rural Virginia. Those selected were used to create PowerPoint slides. One statement per slide, and show them on a loop before the event in the morning for the first speaker and during breaks. People saw the slides and had a variety of reactions. There was laughter, there was confusion, there was disagreement, there was questioning, there was even outrage. Most importantly, there was talking. People saw the slides and discussed thoughts with one another. They shared backgrounds, ideas, experiences, values. The discussions about the slides then carried over into the development of the plan and shaped the mindset of the entire event. A crucial victory was the determination that the process of developing the plan must include a series of regional and public input sessions. These listening sessions allowed for those outside the healthcare arena to hear the key themes and ideas generated by the conference and a chance to offer their thoughts on what should be included in the plan. This is personal experience. 5 regional meetings were held, all in different parts of the state. People attending the regional meetings include a representative from local government, social services, education, business, veterans, economic development, housing, community planning, and more. Local voices who understood that the health of people in their communities is as important to the community as a whole as it was to the individual. Now, did the slides fix the problem of having decision makers located outside of rural Virginia? Did it fix the problem? No, it didn't fix the problem. But it did provide an opportunity to improve our lines of communication so that we could better relay our priorities to them. But why did we do this? Why did we do this?